We'll be discussing issues to do with mental illness. And Sunday is the World Mental Health Day. This is coming on the footprint of a report by the UN survey that ranked Kenya at position 121 of 156 countries in terms of happiness. Recently, we have recorded increased cases of suicides in the country, murders and acts that suggest a nation that is going through a tough time. The COVID-19 pandemic is said to have worsened the situation, but what exactly is the status? What is our mental state as a country, and what can we do to address the issues associated with mental illness? I will be speaking to Gloria Madegwa from the Defenders Coalition Kenya, who will be making things clear for us. Gloria, karibu sana.
Asante.
Yeah. Now, to start with, what is our mental state as a country?
Wow. As a country, we are at a place where our mental issues are not necessarily a concern to us because of the burdens that Wanjiku is carrying on a day-to-day basis. On the streets, you will be walking and meeting people who are talking by themselves, and nobody will really care what they are doing, what they are saying, because we are busy trying to make ends meet. So in a nutshell, how we view our society or how we view Kenya in terms of our mental state is that we are not okay and something needs to be done about it.
Now, on that something needs to be done, yeah, President Uhuru Kenyatta launched a task force who gave their report, but now the question now comes in the implementation of that report, because is it just gathering dust? What's the policy with regards to Kenya addressing mental illness?
I must say that the president really did a good thing to actually to address issues of mental health. The recognition that there is a problem, there is a concern, is a step in the right direction. The task force report is there with very, very good recommendations, and if they were followed, I think we will call ourselves a happy state, and we will not be ranked number 121.
Yeah.
Some of the recommendations include amendment to our Mental Health Act. The current legislation on mental health is actually a 1989 law. That is far behind what other countries are actually using. There is need for this country to amend the mental law as is right now. There have been attempts to do that, but of course, not much has been done. Such a recommendation, if followed, will actually place Kenya in a better position, and most likely we will start addressing the challenges that are being faced within the mental health area. Mental sickness in Kenya is being castigated and more or less being treated as a criminal offense. If you're mental, we all know how, where you will end up and how you will be treated. It is important for us to look at the recommendations from the task force as a country so that we can see from our different areas, from our different perspectives, what can we support the country to do in terms of implementing the recommendations.
Now, that is from a policy point, yeah? But let's bring it down to you and I. How do we tell that Gloria or someone else is suffering from mental illness? What are the telltale signs?
Okay. If you may allow me, mental illness is a disease just like any other. The way I will go down, the way I might have a cough, the way I might have COVID, the symptoms are there. The telltale signs are quite diverse depending on who is suffering the illness. You might have someone who is just withdrawn, and that might be a sign that they're actually suffering from a mental illness. You might have someone who overindulges in drug abuse, and that is a form of a sign that someone is not okay. Kenyans in the streets, as I have mentioned, you will find people talking to themselves, especially next week when now children are going back to school. Parents will have a very difficult time. People are talking to themselves in the streets just because their mental states and state of affairs in Kenya is not quite good to a position where the citizenry can put themselves and say that we are able to move on with our lives without us being affected mentally, because even as we speak, the environment in terms of economic, social, political is not giving us Kenyans a good place where we can say mentally we are in a good state.
Now, I think from that I would go now and ask in terms of the stereotype that do exist when it comes to mental illness, because you find the cultures that we are in makes people think that you're not supposed to talk about mental illness, you're not supposed to admit that you're suffering from it. Others consider mental illness to be witchcraft.
Yes.
So how then do we debunk this and make it easy for people to come forth and state their issues with regards to their mental state and then seek solution?
Okay. Going back to the task force report that was given by the team that was tasked to do that work, one of the things that comes out clear is actually that the cultural interference that comes with regards to people who are mentally ill and how they are viewed in the society. As you have rightly said, right now when you have someone who is not mentally okay, number one, most likely chances are they will be locked inside the house because maybe the family do not want to feel like this is an embarrassment, and we don't want to be a talk in the community that one of us is not well. It is a high time that the government accepts mental illness as any illness, as any other illness. An illness where I might be suffering of COVID, I might have malaria, because you suffering mental illness has a solution. There's a solution to mental illness. So many people who have suffered mental illness are now okay because they received the correct treatment. They were given solutions towards their mental illness depending on what might have caused the illness, and most people right now are okay. So there is need for us to try and address the cultural concerns that come in when you point out that this is a mental illness case and it needs to be addressed.
Now that is from the culture perspective. Now let's come to places of work. Yeah, you find people have pressures to deliver every other new day. People are suffering from ADHD and anxiety, and they're still coming to work and have deadlines and timelines to hit. Then is this something that employers ought to focus on and look into? Because then again, you want someone to deliver 100%, yeah, but they are not in a position to. Yeah. So maybe what would you just say with regards to employers now looking at mental illness from within their institutions?
In fact, if I may dare say that employers need to take mental or well-being of their staff very seriously. Because if I am not okay, if you're not okay, there is no way you can come to the station and work. There are very many ways in which employers can take good care of their staff well-being. And it starts by just creating an environment where the staff or the employees who are there feel like we are being appreciated. The work that we are doing, number one, is being appreciated. And when I shout or I scream that, hey, I am overwhelmed with work, something needs to be done about it. And I'll give an example of where I work. On Fridays, we actually call it Cool Down Fridays. We go to work. Yes, if you have some work you can do, but in the afternoon, we just take time as colleagues, as staff members, to sit down, talk about talk about other things other than work, and also just have sessions, maybe with a counselor who just comes in and tries to bring us to a place where we know that we are not here to save the world. We are here, yes, to do our part, but in terms of saving the world, that is not us. And we should not get ourselves there, because if we get ourselves to a place where we feel that we are here to save the world, then that is where mental illness comes in. So my take would be employers should take well-being of their staff very seriously. Have conversations when they feel like there's an overwhelming part of the staff that needs to be addressed. Have days where it is purely thinking about the burnout of staff and coming up with activities that will ensure that at the end of the day, even when I go back to the office on Monday, I will actually feel that, yes, somebody took care of my mental well-being and I'm in a state where I can continue working.
You launched a report yesterday touching on the mental state of defenders, women rights defenders. So What is in that report?
Yeah. As an institution, we work with human rights defenders in Kenya, ensuring their safety, security, and well-being. And how human rights defenders work is that they ensure that rights are promoted and protected wherever they are. And the report clearly indicated that women human rights defenders across Kenya work in very hard environments and difficult situations. And some of the areas that women human rights defenders concentrate on are actually gender-based violence, issue of land, issues of police brutality, and this somehow has an impact in their mental state, because they will get a case of a gender-based violence and they have to take that case as their own. Women are our mothers, and when they get a kid who has been defiled, they take it upon themselves to make sure that justice is, that the kid gets justice at the end of the day. And what this does to them, it has a ripple effect, because they take the case as their own, and they will stop at nothing to ensure that this kid gets justice. So those are some of the things that we found out, that women in the course of their work take these things very personally, and that has a detriment towards their mental illness. That said, there are very clear and good recommendations on how this can be done. Recommendations to the government. Number one, let's relook the Mental Health Act of Kenya and see what areas we can improve on. And then the task force. It has very good recommendations. However, one challenge that we found out, even when we were doing the research, was that there was very minimal inclusion of people who are actually suffering mental illness when the task force was being there. So there's very little that can be said with regards to mental illness from people who have actually suffered from that. And a recommendation again that we have given in our research is that it is important for the government to come up with activities or areas that will ensure the well-being of not only women, but everybody within the society. At the county level, what is this that we can do to ensure that once in a month or even once in 3 months, people just come and take care of their well-being?
Their well-being.
Yes.
Thank you very much, Gloria Madego from Human Rights Defenders. And this conversation is going to continue. Remember, tomorrow is the World Mental Health Day. The conversation still continues, but now we go